Hello, good morning, and welcome to Nurse Amy channel. So right now, oh my God, it's so cold. Look at me, look at the way I'm dressed. I tell you, it's cold time. It's I don't know, I can't flip the camera, but if you look behind me, you can tell that, do you see that? It's kind of foggy. But anyway, so a new day, and I thought I'll try this again because people keep asking for it. Is another new day. Oh, my hand's blocking the camera. Okay, hopefully now. First day of class, and getting started to go. If you're one of my regulars, thank you so much for tuning in again and seeing the new episode I just uploaded. If you're new here, my name is Nurse Amy and I do everything CNA. I'm a CNA instructor. I'm actually on my way to school right now, and I do beyond that. I life coach, I do lifestyle videos, I do things like this because it's a request by my students and those of you here, faithful watchers here on this page. So that's why I'm doing this. So try not to go late to work. So I'll catch you when I get to school, okay? And if you're a new person here, please remember to subscribe and hit the notification bell so every time my video comes up, you're the first to know, okay? Thank you so much, and I'll catch you later. Okay, so I'm actually turning into school, and thankfully, something we always struggle with here is parking, and it seems like I've got space here, so I'm just gonna make use of it. There's always something we have to deal with. So I'll meet you on the inside, okay? Let me just go ahead, get my stuff, and then I'll meet you on the inside. I hope my radio wasn't too loud. Okay. So I'll catch you. Okay, walking into the building. It's so cold, and I think my camera is kind of foggy. Sorry. Trying to clean up my camera. Ooh, let me run into the building. Yeah, running into the building. It feels so much warmer in the building. Going towards the second doors. You've done this with me before, so you should be used to this. Look at me, I look like a burglar. Going towards my class. Are the places where they sneak up on you, okay? They will be taking questions from those things, okay? So long-term care is, like I told you guys, is 24 hours skilled care, okay? So you need to know that. Again, when I'm telling you to note things, you should be noting it, okay? Length of stay. What is length of stay? Sylvia. Oh, just in case you guys didn't know, it's an interactive class. I'm not the only one who just gets to talk. So, Sylvia, what is length of stay? Well, yeah, it is. Again, it's right in front of you. You can read it, but even if you read it, I would expect that you understand it, or at least try to explain to us in your own words. It is. It's the number of days a person stays in a place to receive care. Okay. And then we have terminal illness. Songo, what's terminal illness? True. Basically, that's what it is. So I'm going to ask this question. So if you have been termed or determined to be terminally ill, are you definitely going to die? Okay. Songol says yes. Is everybody in agreement with that? Again, it's interactive, people.
Yes.
Okay. So Sarah agrees with Songol. Is there anyone who disagrees? I need your maxed out. I can't hear you. You said what? You could always recover. One thing you need to know about healthcare or life, there are no absolutes. Okay? Yes, you've been determined that, hey, you might not make it, but people make a 360 degrees turnaround. And like Nathaniel says, you could always recover. Okay? So you just need to know that. All right. So now we come to chronic conditions. And I'm going to ask Andrew, what are those?
It's a condition that lasts a long period of time or even a lifetime.
That is so true. So can anyone give me examples of what those conditions are? Nice one. Chronic back pain, she says. What else? But that's good. I like the fact, because a lot of times people leave out pain. But it's a chronic condition. Yes, ma'am. Heart disease, that's true. There are different types, okay. Anyone want to add anything to that? Asthma, okay. Yes. Yeah, Andrew said that. So now I want examples of what those conditions are. Okay. So in this class, what we do is, just so we're not speaking over each other and we're being respectful, we raise our hand and you get a nod from me and then you can respond. So Michaela. Dementia. I know your book actually has dementia there too, and that's true because dementia has early onset, the middle stage or the intermediate stage and then the latter stages. Okay, yeah, because you're not going to recover from that. Unless, of course, again, like I told you guys, miracles happen, right? Miracles happen. I know I just didn't sing that, but any more? Yes. That is a big one. Look, if you don't know anything else, know that. Okay? That is so true. That is so true. There's another one I'm looking for, which is also very popular, and is along those lines. And you guys are doing great, by the way. But those are chronic things, chronic conditions. Andrew, have I asked you?
Asthma?
No, that's been taken. Yes, ma'am. AIDS? Yeah, people live with it. I mean, someone's been living with it since 1992. Do we know who? Anyone into sports? Yeah, that's definitely chronic. Yeah, yes, ma'am. Yeah, you're just gonna look at your book and then pretend like you thought about it. I saw you, girl. Hypertension, high blood pressure. Okay, CHF. You might not know what CHF is, but that's another one. COPD. Okay, those are chronic. They're just things, they're not going away. You just manage them. Okay, so at this juncture, what I like to do is juxtapose chronic with acute. So chronic is more, again, is long lasting. It's something you're managing. It's not necessarily going away, but is also stable. Okay, does that make sense? It's stable. You already know what the symptoms are, and we're just managing it. However, with acute, it's sudden. It just means something that is stable becomes unstable. Okay, so that's one way you're going to find that I teach in this class, is trying to put opposite words or sentences or conditions, just a way to help you. Those are cookie points. Those are Nurse Amy's cookie points. So when you're thinking chronic, you're like, okay, chronic is this, then whatever is in chronic is acute. Does that make sense? Or if you know acute, you know what's not acute is chronic, right? So acute is just the opposite of chronic. It's sudden onset, it's unstable. You get cured. You could actually get cured from that. So what would be acute? Yes. Pneumothorax. Okay. Yes. Because what happens is you take care of what that thing is, and then you bring them back to status quo. Okay. How do you even know that?
I had it.
Oh, you did? Why? Girl. Yes. But that is so true. Yes. So what else, ma'am? Miss Emerin? A stroke. Okay, yeah. Again, hypertension, or for whatever reason you get a stroke. Okay, yes, they would try to bring the stroke, take off whatever it is that caused that stroke, right? Does that make sense? I'm trying to speak baby language. I don't want to go into too much terminology for you guys, but yes, then you bring that person to status quo, or as close to status quo as possible. So I guess we could, that could be because it's sudden, right? Good. And fever, somebody has a fever, okay, headaches, somebody has surgery. Do you see what I'm saying? Something that kind of is out of equilibrium. Right? Your something happened and your body's just crying for help. So you do need to go. It's acute. It came on. It needs to be set right, and then you're brought back to your normal or as close to it as possible. Okay, so that's the thing. So just know that difference between acute and chronic. So that's just my way of helping you guys. Because you're going to find later on in this chapter, we're actually going to talk about acute, but we already took care of it, okay? So do you all understand that? Because a lot of times it's used wrongly, right? When people are talking about assault, they actually mean battery. So assault is intent. When you threaten someone, okay? Does that make sense? And you'll get questions like this sometimes, they will ask you. Because they can. So yeah, that's what it is. And then battery. Battery also is you putting your hands on someone in the nursing home, in the hospital, in the doctor's office without their permission. Sometimes it's implied because, again, when you go into the doctor's office, they're going to be putting their hands on you to take your blood pressure, right? But there's certain types of care where you actually need to. And that's why a lot of times you need to wear your ID badges. You saw they took your pictures today. People need to know who's touching them. Okay, because there are a lot of weirdos these days. I watch too many movies. You have cray-cray people acting as doctors, We don't say cray-cray. I'm trying to be funny. But yes. So thank you. That's good. So the next thing is we are going to go to page 15, where you have neglect and negligence. What is the difference, Miss Amarin? Are you an attorney? That's impressive. It's good. It's very good. Again, you get us to clap for you. She likes that. That is perfect. Neglect is you just don't do what you're supposed to do. And negligence is you're being sloppy. You know what you're supposed to do, you're just sloppy. You did it wrong, basically. What's the difference between negligence and malpractice? kicking ass. Oh, did I say that? Kicking butt? No? Okay. Miss Sarah, you want to try?
Yeah. Negligence is, like she said, it's pretty much like the medicine situation where they give the wrong medicine. And malpractice is someone like if they need to be put in a warrior and they don't do it correctly, and they don't take the time to do it correctly, and an accident falls or something of that sort will be malpractice.
And that's
they know how to do it, but they kind of skip a few steps to try to do it faster.
Now, it's interesting that you guys use different examples for those two words, you know, but giving medication error is also malpractice. But anyway, anyone want to add to that? I hear what you're saying, but anyone want to try the difference between negligence and malpractice? Again, you don't have to be right. You don't have to be like Emma Rain, who's just getting us to applaud her for everything. Just go for it. You try. Everybody gets a chance to shine. Mr. Nathaniel. Perfect. So he gets a chance. Do y'all hear that? Everybody understands that? Does he need to repeat it? Yes, please, for the class. Ding, ding, ding. Very good. Yes, very good. Thank you so much, sir. That was great. Pretty much that's what it is in a nutshell. Okay? So we've done ombudsman. Y'all know HIPAA. Who knows what military time is? Military. Yes, ma'am. I want you to look at page 18. I know you want to rack up all that applause, but it's a type of time telling. So that's what I want to know. Yes, Miss Janelle had her hand up. Very good. Yes, that's what they call it. I know a lot of people don't know that's what it's called, so I know you know it. Does everybody know that? Not what military time is, how it is, how you would give it. Songol, do you know? Yes, I know you don't. There's a reason why I asked you that. Because again, depends on. Again, it's not about age here because I've had people younger, but I find that more and more younger people really do not know what it is. Okay? So you want to tell us what it is, Ms. Janelle? Because the clock is 24 hours. We're doing 24 hours a day. So as opposed to when it's 12 noon and we go back to say 1 o'clock, and that's why they say military time. They say 1,300 hours, meaning 13, 14, until it goes back up to 12, where it's 24. It's 24 hours. And then we start to count, because 24 hours is also 000. It's like we're recalibrating. And then 1 a.m., 2, 3, 4. Do you see how that works? I think it's just not to create, so there's no confusion. So they use that in the military, but then we use that in healthcare too. You're gonna need to know that. They would always bring questions. They're gonna tell me what 3 p.m. is. What is 3 p.m.? I'm asking Songo. Think about it. See how that works? That's what it is. I said 3 p.m. Yeah, I said 3 p.m. That's why she said 15. 3 p.m. Now in your book, it actually tells you how you can calculate it. I didn't know there was a calculating thing. But it's about you adding 12. Or was that 12? to the number, and that will give you the time. Okay, it's in your book. So on on chapter 2, you need to know verbal communications and non-verbal communications and what the difference is. Okay? You need to know objective and subjective information and examples of what they are. Objective and subjective information. So while we're here, what is objective information, Sylvia? It's on page 22. Because we are in chapter 2. And what is that? I mean, which one are you describing?
Objective.
Okay. So what is subjective? So if, okay, that's fine. Can you give me examples of subjective? Anyone want to help? No, Sungul, no. I want somebody else. Mr. Andrew?
A report of the pain a patient may say that they have.
Yeah, that's subjective. Like I tell you now, I have pain. You can't measure it. You're going to go by what I said. Pain is what the patient says it is. You do not determine pain. Now that I have pain, I live with pain. Again, I mentioned earlier on, I could be watching my Netflix, having fun. That doesn't mean I'm not in pain. I have to find a way to cope with it, right? So that's the same thing when you work in the healthcare field. You need to be very, very conscious of that, because that's something I find nurses and nursing aides and even doctors. And when I say doctors, that's an umbrella for all the nurse practitioners and the PAs, okay? And anyone that can prescribe medication. Very often, people are so quick at labeling people as drug seeking. That's not your job. If you're not walking in their shoes, do not label people. Don't put labels on people. If this person tells you they're in pain, they're in pain. It doesn't matter that they're laughing on the phone and kicking and cackling. No, they told you they're in pain. Because again, when you go to give pain medication, you would ask them to rate their pain. And they will tell you, oh, I'm a 20. Oh my God, it's 100. And then people come back to the nurse and say, like, please, it's just drug seeking. He can't be that much in pain. He's laughing. Don't you hear him laughing in his room? Okay. So he's laughing. We all have different threshold of pain. We all have different threshold for pain, right? Okay. So, you have people in labor. People do it too in the labor wards. You know, a woman is crying out for, oh God, I need something. They're like, drug seeking. No, don't do that. Okay? So subjective just means they tell you what they're feeling. Okay? Pain is a good one. I use pain because that's something personally I know about. Okay? So, and then the objective one is that you can measure it. Right? What are some things you can measure? Blood pressure, very good. The temperature, things like that. Okay? That's very good. That's very good. Very, very good. You need to know those. You need to know that. Okay? Let me see. Things that you need to know. Cliches. Describe barriers to communication. Describe barriers to communication. There are certain things that are going to impede your communicating with your patients properly. One of them is cliches. Okay? One of them is asking them why. You need to know what these things are. It's on your page 25. You need to know what those things are. Okay? One thing you can be sure of, you're always going to be asked this every time. There are certain, I call them usual suspects. Questions they would always ask you. Question about diabetes. They're going to ask you how you communicate, how you ambulate, how you dress, people with hearing impairment, visual impairment, people with a left or right side weakness. Just prepare yourself. You're always going to get questions on those, okay? So again, communicating with hearing impaired. Do we know what hearing impaired means? Because you're not going to see a word like deaf or blind. It will be hearing impaired and visual impaired, okay? So hearing impaired will mean deaf, okay, Sylvia? And visual is blind, okay? They're going to have you, how do you communicate with a combative patient? You cannot slap them back, even if you're tempted to do so. You cannot, just like you cannot slap people on the streets, okay? It's the same thing. One big thing, and you're going to find as we go on to do our skills, is body mechanics on page 31. You need to know how to bend. You need to know how to pick up stuff. Those things are going to come up. You're going to be watched doing your skills. It's something we're going to do in class. It's something I'm big on. Body mechanics. Why am I big on it? Because they're going to be big on it when you're doing your state testing. Okay? Probably won't be having all this back pain now if I practiced this properly. I can tell you right now, it's easier said than done to practice this. But there are people, a group of people who do it so well. When you see them, you just admire them. They're in the healthcare, but their body mechanics is perfect. Does anybody want to guess who these people are? Occupational? Okay. Yeah, maybe-ish. I'm saying maybe-ish, but she's in the right direction. Who else wants to guess? Physical therapist. Oh my God. See, she knows. You see them, they don't play. Because they work with bones and muscles and what have you, and they know. If I probably was a physical therapist, I wouldn't be having this pain I have. I'm telling you. I would have been bending the right way. Physical therapists, you got to give it to them. Those people, they just go. Squats. They don't play. They're good. But we in the nursing field, we're tugging, we're pulling, we're doing all kinds of silly things that, again, when you've spent enough time as I have in the healthcare field, you start to have pain. If it's not shoulders, the back is the knee, the neck. I tell you. Okay, you need to know what to do in times of fire. The option of running out of the building by yourself is not the right one. Okay? So on page 36, you're going to see the word RACE, the acronym RACE. That is what's going to guide you. So anytime you see any questions on fire, safety, you have to take care of patients or situation in a fire situation, you will need to think about the word RACE and then go through the acronym. If R isn't part of the option, the next one will be A, right? That would help you to pick the right answer. Does everybody understand what I'm saying? Okay. Again, the option to run out of the building by yourself is not one of them. Or push people out of the way. I can tell you right now for free, that is not the right answer. Okay. All right. Okay. We're gonna go straight to. Well, one thing about, let me see, something they probably would ask here is bleeding. When people are bleeding, we know we have to put pressure, right, on the bleeding to stop it. Okay. Now, the next thing I actually want to go into, there are some things here I'm saying, but we're gonna cover them in the skills. I don't take skills from here. Why don't I take skills from this book? Miss Song.
Everybody's different, every situation.
you're in the neighborhood. In the neighborhood. Because every state is different, yeah. But every state's got their requirements. And since we are here, that's what we're gonna do. So now we come to page 46. Infection control. Yes, ma'am. Hey guys, so this is me. We're actually all at lunch now. Let me turn around so you can see the class. They've all gone out to lunch. So it's just me and you can see my lunch. I'm eating healthy. I try to sometimes. But anyway, you're wondering why I have this on. Oh my God, it is so cold. It's not a joke. Look at me, I've got the round neck thing I'm wearing inside my cargo military jacket just to keep warm. All right. And I'll catch y'all later. So it's the end of the day and I'm going to my car. So what I pretty much did, let me see, what did I do today? Well, pretty much the same things you've seen me do in other videos, and that's just registration, getting all their names, and because it's an accelerated program, oh, I can take this down. We had to teach skills today. I taught skills. That's what I do. Okay. So that's it. Why am I having to always literally manually use my keyless entry? Press it. Why do I have to press it? It shouldn't be that way. It should be that when I just get here, it will open automatically. Okay, so I'm going to the passenger side, but it's been okay. It's been good. Again, new crop of students. You might get to meet them tomorrow. So I'm probably gonna loop this. Oh, my back. I'm gonna loop these. Yeah, that's what I'm gonna do. So I'm gonna have you meet my new set of skills. I'm gonna have you meet my new set of students, okay? So today was the first day and we did good, we did okay, we did great, we got to know each other and everyone's laughing and kicking and kakai. And then I'm gonna get to meet them tomorrow. All right, people, so I'll be on my way now. It's usually at the end of the skills. I'm so tired. All right, folks, let me be on my way. Okay, my belt. That's my belt. Okay. Alrighty. No, do not. I gotta put my glasses on. It helps me deal with the glare. It also makes me look cool. Don't you think so? Anyway, so like I said, I'm going to loop this video with another one I'll be taking tomorrow. That way you get to meet my students. So here I am. I'm moving and I'm ready to go. All right, so I'll see you in the next video. Well, it's just the second day. Oh, you know what I just thought? I can actually do everyday teaching. So I like that. I think that's what we'll do. You know, I would have every day I'll take a video of what I'm doing and then compile the whole duration of the program. That's what I'll do. So catch you on the next, I'll catch you tomorrow, the next episode. So this is the end of episode 1. See you on episode 2. Stay blessed.